Good afternoon, ladies and gentlemen, and thank you for attending our short video presentation outlining the details of the recently performed SHARE-Kidney study, a study that was co-authored and co-produced with patients and colleagues alike.
On the 23rd of March 2020, in response to the COVID-19 pandemic, the UK entered a continuous period of lockdown.
This study covered the period beginning with the 23rd of March lockdown, progressing through the varying government messages of stay alert, the introduction of support bubbles, and eventually towards the easing and re-emergence of patients and young people from lockdown.
Early on, many children and young people were shielded based on adult criteria. As the months went on, reassuring data allowed the guideline to relax until shielding was paused altogether in the middle of summer.
Previous data from other pandemics involving SARS-CoV-1 and MERS led to the conclusion that people with chronic medical conditions suffered high levels of traumatic distress during these infective pandemics. We also know from previous studies that children and young adults with chronic kidney disease or on dialysis have consistently the worst quality of life indicators across the board. They have higher rates of social behavioural problems, such as adjustment disorders, depression, anxiety and neurocognitive deficit, generally have worse educational attainment, are less likely to be in a stable relationship and more likely to live at home, therefore more likely to receive no or less income, and more likely to be unable to work due to ill health. There exists the additional concern in children and young adults around childhood and young adult safeguarding issues, and the idea that patients can become invisible during these pandemics.
There was one point where I saw the news and I just thought, actually, we need to lock down now. I felt as if it's better to lock down and then be told, no, you don't have to, rather than just wait and leave. I felt Tom was quite vulnerable at that point. It just became obvious to me, common sense or whatever, or a gut instinct, or whatever you like to call it, figures were going through the roof. And I just felt Tom in his state, particularly he'd been ill a couple of weeks before and ended up in hospital with flu. So I just felt he was in a very vulnerable state, and that, just to stay at home was the safest thing to do, really.
So what were we hoping to achieve? Well, we wanted to understand the impact of COVID-19 on children and young adults, and also the parents of young kidney patients. We wanted to hear about their experiences with regards to the pandemic, to understand their information and support needs, and understand the factors affecting their decision making during the 2020 lockdown. So this is how we did it. Working alongside and co-producing this study with children, young adults, parents and partner organisations including Kidney Care UK, BAPN and the Renal Association, an online questionnaire survey was devised. Self-reporting children and young adults aged 12 to 30 and parents of kidney patients aged 0 to 18 years were recruited by healthcare teams, national kidney charities, close Facebook groups and wider social media. The survey ran between the 11th of May 2020 and the 1st of June 2020, just as the path to shielding relaxation was laid out by the UK government. A series of closed questions and free text boxes were used to capture information around general experiences, information sources and use, decision-making and the support needs identified.
The parent voice and the patient's voice, because it feels like we're being involved then and collaborating with our consultant, our medical team.
It's very important that the patient voice is heard so that the medical team can work with that and then hopefully help them get through what they're going through.
So what did this survey tell us? To begin with, we had 118 child and young adult respondents with a median age of 21 years. To add to this, we had 197 complete parental surveys, the majority of which were mothers and the majority of which were of white ethnicity. From the closed caption questioning, several themes emerge. Whilst both the majority of children and young adults and parents were both vigilant about viral symptoms and were more vigilant about their kidney symptoms in themselves, there was a significant difference between the groups in terms of the degree in which they're worried about the virus, with only 40% of the children and young adults reporting worrying about the virus compared to 80% of the parental respondents. Children and young adults reported significant impacts on their education and work opportunities, although did not extend to financial hardship. Significant numbers in both groups reported feeling protected by current shielding advice, although the parents felt slightly more protected than the children and young adults. Children and young adults were concerned about emerging from lockdown, and the parental group were specifically concerned about importing the virus to the home environment and affecting other family members such as siblings. With regards information sources and needs, around half of children, young adults and parents reported receiving sufficient information from their clinical teams. Social media appeared to be the main source of information about COVID-19. However, both children and young adults and parents reported not trusting this information and not being made more anxious by reading it. With regards to the response to the support needs, the majority of children, young adults and parents did not want or need additional medical or educational support in closed caption questioning. An important subgroup analysis was performed, splitting the patient and parent groups into those who were shielding and those who were not shielding. Significant differences were found between these groups in the following areas. For children and young adults, shielders were more vigilant about kidney and viral symptoms and were concerned about the isolating effects of lockdown. Children and young adults who were shielding feel that they received significantly more information from their clinical teams. With regards to the parents of children and young people who were shielding, they experienced amplified negative experiences in terms of viral vigilance, concerns about going outside despite social distancing, concerns about the negative effects from isolation on their child, and the negative impact on other children in the family. They had heightened perceived risks of medical visitors and were more likely to request school support compared to the group that were not shielding. Interestingly, several positive experiences were reported. Respondents noted that they allocated more time to themselves, spent more time with family and friends, and developed healthier lifestyles and a better work and life balance. Parents in particular reported improved relationships with other family members.
So this is just a short summary of what more than 300 young patients and parents told us. Young adults with their unique needs are often forgotten or swept up with a much wider patient group. We hope this survey helps redress this balance. I want to leave you now with our summary and recommendations, and with the last word going to Thomas.
You told us about your fears and concerns. We listened. You told us about the shortcomings in direct, personalised information, and we listened. Children and young adults told us about the massive impact on education and employment opportunities. You impressed us with your pragmatism, common sense of community, and collective responsibility. Parents told us of the concerns about their children and the universal parent guilt of potentially making your child sick. You have gone to extraordinary measures to keep your loved ones safe and are concerned about how we emerge from lockdown safely and successfully. Those of you who shielded experienced even more negative experiences whilst recognising it was the right thing to do. The effects on you, your siblings and carers cannot be underestimated. It now falls on the medical community to act on these concerns, and that work has begun with the development of central, regularly updated information repositories and refinement of risk categories with this data. We have released swathes of patients from shielding, reopened schools, restoring the educational and deployment opportunities to a generation, and harnessed new technologies to overhaul the delivery of medical consultations. We listened with interest to the positive outcomes reported and once-in-a-generation opportunity to reconnect with our closest family members. Much work is left to be done, but together with shared decision-making, future lockdowns and pandemics can be managed very differently from the very start.
Don't worry about COVID, we'll all be in together, we'll be just fine. That life has been hard with COVID-19, but no one has to worry. I mean, it's okay to be scared, but we don't really need to worry. We're all in this together and we'll pull out of it, I promise.
Thank you to all our teams, charities, parents and patients who've all made this possible. Thank you.